Thank you very much indeed, Professor Cox, and thank you very much to the organisers for their very kind invitation to Julie and myself. I'm really here to set the scene, and Julie's going to take it up and present some material and some thoughts about it. So what's the background? Well, I am a psychiatrist. I actually retired from clinical psychiatry 2 or 3 years ago, but I divided my time for many years between applying psychological and psychiatric understandings to dealing with individual patients who were coming along with complaints of various kinds in the NHS, and addressing those same kinds of ideas to dealing with the community that I was living in, which was similarly disrupted, though with perhaps different symptoms, but symptoms of sufficient severity that they led to the deaths of many people and the injury of many others. So there was a sense in which, for me, my community was on the psychiatric couch as well as my patients. And my background was in medicine and psychiatry and psychoanalysis. And when I started off the work, it wasn't actually possible to train in Northern Ireland because there weren't enough resources there. And so I came backwards and forwards to London every month, and I got my supervision down the telephone on a Sunday night from Sheila Davies, a very long-suffering and very able psychoanalytic psychotherapist and psychiatrist. And eventually, after a number of years, we began to build up a small psychotherapy centre. And of course, as you can imagine, at the start, the focus was very much on individual, psychodynamically informed psychotherapy. After that, some cognitive work, some family work, particularly with children and young people with eating disorders, which was a particular area of concern and interest. But it did seem to me very important in our context in particular, though I think more generally it's true as well, to find ways of engaging people psychologically that did not necessarily involve them using words all the time to describe their problems. And there was one particular circumstance which really shouted this out very loudly. I was approached because of a rash of suicides of young men in North and West Belfast. Now, North and West Belfast has probably seen more violent deaths and injuries than most places in Western Europe, because that's where the IRA, and therefore the British Army, and a lot of the loyalist paramilitaries operated very freely over quite a long period of time. But still, even with all of that background, it was very noticeable that as the Troubles came to a close, these young people, young men in the main, were harming themselves repeatedly and sometimes fatally. And I was approached from two directions. One was by a woman who was very concerned. She was working in the community. Her husband had actually been one of the leaders of the IRA hunger strike. He'd come to the conclusion that it really wasn't a very good way of promoting his own cause and vision, and he left all of that behind. But she was working with a lot of these young folk, and she was finding it very difficult and discouraging and disappointing. And she found it very difficult to engage the caring professions because these young guys wouldn't come along to clinics. You could get them referred all right, but they wouldn't pitch up. Or they would come the first time and they wouldn't come after that. They would come and they would not talk. So I was approached from that side. The other side of it, like wearing my political hat, as it were, I was a member of an international commission whose responsibility was to monitor and publish the reports of the monitoring of paramilitary activity and security force activity. Who was doing what, to whom, how many beatings, how many shootings, how many kneecappings, and so on. And we did this every 6 months or so. And I was approached in that role as well with the same problem. Here are these young guys, and we don't know what to do with them. So what do you do when such a thing happens? Well, the sensible thing is you go along and find out. Go to West Belfast, sit down and have a chat with some of these guys and see what's going on. And one of the things that became very apparent to me was that there was no point at all in trying to set up some kind of clinic or normal clinical service. First of all, as I said, they wouldn't come. And secondly, it was quite striking how difficult they found to put things into words. Indeed, more than that, it seemed difficult for them to even be aware of feelings in their bodies, even physical pain. I remember the first day when I was there, this guy came and he had his arm wrapped around with an old dirty bandage, guy of about 17 or 18. And I said, "What's wrong with your arm?" And he said, "Oh, there's nothing wrong with the arm." I said, there must be something, you've got that bandage on it. And eventually I cajoled him and persuaded him to take it off. And he had a huge open gash right down to the bone, with just lying open. And I said, that's pretty bad looking. It might be a good idea to get that seen to. And he said, no, there's nothing to it at all. And it was only when I persuaded him that one of the things that he wanted to do, which was play a particular kind of sport, was going to become impossible because he was going to end up losing that arm. Then he said, okay, I'll go and get it seen to then. But he didn't even feel the damage and the pain that was being done to himself. And that was something that had happened the previous night. So the question for me was, well, what do I do? As a psychiatrist, as a psychotherapist, as somebody who's interested and concerned with these young people. I thought, well, we've been trying for a little while to enable some of our patients to approach speaking about feelings through using art. We'd brought in one or two art therapists and actually got a master's course underway, because we found that sometimes people could use clay or use paint or draw in such a way that after a little while it became more possible to speak about things. And even if they didn't speak about things, the process of doing that sometimes was very helpful. We also discovered that it was possible to use drama, to act things out. And that was a piece of experience that had gone back to when I was working with alcohol and drug-dependent patients in Belfast some years before. But one of the things that was very difficult with these young lads was to do something that didn't seem girly. They wanted something that didn't make them not feel like men. And so Dr. Julie Sutton had been working with me for some time trying to use music to engage people and find ways in which they could begin to express themselves in music, in sound, in rhythm, in pitch, with different kinds of instruments, some very sophisticated, some very simple, and to draw people out, and in a way to draw them into some kind of therapeutic relationship. And at the same time, there was a young man who had come as a junior psychiatrist, very interested in psychotherapy, and he was quite a passable saxophonist. And so I said, look, I tell you what, would the two of you come into West Belfast with me to this old rundown building, and we'll see if we can get a bunch of these young guys together, and we'll just see what happens. And so that's what happened. And Julie and Ian together started to find ways in which they could enable these guys to use rhythm or sound, pitch, developing a little bit of music, but somehow or another, things like drums, we're kind of well known for drums in Northern Ireland, or an old guitar or something of that kind, or even making a sound, that seemed to be okay for these guys. And over the next couple of years, Ian and Julie were able to work with these very, very disturbed young men and get them to come. They didn't come on time all the time. They didn't even come sober some of the time. But whether they were sober or not, they were still able to engage in some fashion in a relationship through the medium of music and sound. And so Julie's going to say a lot more about that, about the experience of doing that work with these young folk who were not amenable to doing something else, but who did engage with this, and also to say something about the ideas that have developed in this kind of work. And by the way, she's also done work and had been doing work previously in other places, for example, in Bosnia, both directly and supervising and helping others who were doing that kind of work. So it's a very great pleasure for me to be here with Julie. She's continuing to work on in the Centre for Psychotherapy in Belfast. I'm trying to make a different kind of harmony at Westminster, but she's here with me, and I'm very pleased and proud to be with her today, and she's going to present some material. Julie, please.